This week for EM5, we're going to talk about some different parasitic infections of the skin. And usually patients present with a rash that's very itchy. So let's start off with this case. There's a 6-year-old girl, intense itching in the hands, a little bit on the wrists, between the fingers. It's been about 2 weeks, and her brother actually has the same thing, and it's much worse at night. So what are you thinking for this patient? Okay, good. So scabies. So scabies is caused by a mite that bites the skin and then actually burrows under the skin, laying eggs as it goes. And you can get irritation from both the bite and also from the type 4 hypersensitivity reaction, which can get worse, especially if you've been exposed before. And it's also much quicker if you've been exposed before. The most common spread is skin to skin, so you'll really see this passed frequently between siblings and around families. And it can survive off the skin, like on clothing, for up to 2 to 3 days. The rash tends to be worse at night and is usually to the fingers, flexor surfaces, and the wrists. The treatment is to do a 5% permethrin cream to the entire body, and you have to leave it on for a little while, either 12 or maybe even up to 24 hours. And the idea is you need to repeat it in about a week. As far as treating the itching, just Benadryl or maybe even a quick steroid burst can be helpful. The other thing is at home, make sure you treat all the family members and have them also wash all their clothing and bedding in hot water to get rid of any scabies that might be on those items. As far as back to school instructions, you can let them know that they can go back after the first treatment. Okay, for our next case, we have a 26-year-old female coming in with this scaling and itching rash to her bilateral eyelashes and eyelids. It's been for about a week or two, and she also, on review of symptoms, happens to have some vaginal discharge and discomfort. So what do you think is going on here? Okay, this is lice, and specifically, this is a little tricky, this is actually pubic lice or crabs. I'll explain in a minute here. So the most common thing we think about with lice is going to be kids coming home from school, they have a really itchy scalp, you take a look in their hair, and yep, turns out they have head lice. So the adult lice clamp onto the hair shaft with these kind of claw-like structures and lay eggs which are very firmly attached to the hair shaft itself, and that was the nit that's in this picture here. They feed by biting the skin and feeding off the blood, and that's actually what causes the itching. And this is what you'd see on a head lice exam. So you can see both the nits, which are the eggs attached to the hair strands, and then the lice, which are closer down to the scalp here. That's the adult form. So there's 3 types of lice that are common. Capitis, it would be the scalp lice, and that's really common, especially amongst kids and siblings, family members. That's going to be mostly from shared hats, clothing, bedding, especially common in the winter when kids are at school and sharing. Next is the slightly smaller version. That's the pubic lice, or crabs as it goes by. So that's going to be in pubic hair. It's mostly sexually transmitted. It doesn't actually transfer to the hair on your head because that's a little bit too dense for it to live in. But it can be transmitted to eyelashes in partners who are participating in oral sex. So that's something to look for. If you see the lice on the eyelashes, it's actually probably pubic lice, and you need to be looking out for other STDs as well in those patients. So the last thing we have is body lice or corporus, and that's a little different from the others in that the adults don't actually live on the body. They live in the seams of clothing, especially in people who don't change the clothing often or aren't able to wash very often. And at nighttime, they'll hop over to the body, feed, cause these really irritating, itchy lesions, and then go back onto the clothing. The most common place that you'll see that rash is on areas that are covered by clothing. And the treatment is going to be to do an insecticidal either lotion or shampoo, such as a permethrin shampoo, and then go through the hair with a very fine comb to remove any of the nits or adults. The tricky part here is that it doesn't necessarily kill all of the eggs, so you need to repeat this process in about 1 week to make sure you get everything of all the stages. Again, make sure you treat all family members and let them know that they can go back to school or work after the first treatment. Okay, last up we have a history of a 56-year-old male coming in with lesions that look like this on his bilateral arms. He says that it's very itchy, and he notices that it's worse every time he sleeps in his favorite easy chair. So what's our cause here? Yep, the dreaded bed bugs. So bed bugs, kind of like that body lice, don't actually live on people. They're going to live in mattresses, that's the most common thing, or in furniture, especially in the seams or the cracks. And at night, they'll climb out onto the host and bite and feed on any exposed areas. So that's one thing to look out for the rash. And you'll tend to see the bites in little clusters as they crawl along and bite and feed. And in the morning, you'll notice that they'll be very pruritic and sometimes can have quite significant rashes. So the next question is, how are you going to treat the bed bug bites? And unfortunately, unfortunately, the only thing you can provide in the ER is treatment for the itch, so suggest Benadryl or maybe a topical corticosteroid. As far as getting rid of the bed bugs, it's really difficult. You pretty much need to call pest control to do a treatment or superheat the room to really get rid of them. But you can suggest trying to do things like actually vacuuming them up. You can use a hot hairdryer to force them out of the seams and then just vacuum them. Try to wash bedding and clothing in either really hot water or alternatively you can freeze it. I also tell patients to try to aim a fan at them while they're sleeping. The bugs don't really like that moving air and tend to bite less. And overall, just educate patients not to pick up old furniture on the street. It's a really easy way to pass it. So next time a patient comes in with a rash that's really itchy and kind of focal, you can think about scabies, lice, or bed bugs. If it's on the hands or the fingers or the web spaces, runs in the family, especially in kids, think about scabies. The treatment's going to be permethrin and repeat it in about a week. If it's more on the scalp or the hair, think about lice. Again, treatment is permethrin, repeat in a week. And if it's more on exposed skin and you don't actually see any bugs, unfortunately you have to think about bed bugs in that situation. Tell them to go home and examine their mattresses and their furniture. Remind the patients they can go back to school after the first treatment, and also warn them that it might take 1 to 2 weeks for the itching and the bites to really resolve due to the hypersensitivity reaction, even after all the bugs have been killed. Here's some references, and thanks for joining us on EM in 5.